Chinese health officials revealing the number of frontline workers infected by the novel coronavirus, known officially now as COVID-19, is just over 1,700.
Of those positive cases, 6 people have died, most in the Hubei province of China, at the center of the outbreak. In the U.S., there are only 15 confirmed cases, according to the Centers for Disease Control's latest report today.
Now, even with significantly lower numbers, hospitals across the country are prepared for any kind of outbreak. Today, I spoke to a specialist at UT Medical Center to learn why and how they stay ready for any potential disease outbreak.
We have a pandemic novel infectious disease plan, and this plan has evolved over years, but it's a generic plan to respond to newly emerging infectious diseases.
The plan, rarely used but available. Mark Rasnick is an infectious disease physician at UT Medical and recalls the last time it was put into action.
Our team was enhanced not too long back to be more prepared to respond to Ebola alerts, and we've had some Ebola alerts that were fortunately false positive.
Right now, local doctors are focused on widespread outbreaks impacting Tennesseans, like the flu.
I have several people in the hospital that are, currently suffering from complications of severe influenza, and so that still remains the more pressing threat immediately for East Tennessee.
It's unlikely this new strain of the coronavirus, now called COVID-19, will impact East Tennessee in the same ways we're seeing abroad, but hospitals like UT Medical Center are prepared for anything.
This would be more enhanced use of personal protective equipment. This would require escorting the patient through the facilities. It involves special rooms with special air handling so that the air doesn't recirculate to other things.
Rasnick says it's typical procedure to ask patients about travel history, especially if doctors are following viruses abroad. Anyone entering the hospital today will see a sign with a reminder about any recent travel plans to China. The team here is prepared.
We've actually exercised our response capability several times to make sure people are ready to identify the triggers to start our special procedures, and that people know who to communicate with and who to call when we have a situation.
Now, he emphasized how rare it is, of course, to use that plan, especially long term. And he says there's already a staff in place that's trained to respond quickly.
I know people were wondering, though.
A big question that we were asked, so we wanted to answer.
Yeah, absolutely. Now, again, just to reiterate, 15 confirmed cases in the U.S., 347 negative cases, 81 still pending testing. We will keep you updated.